The head, neck, and shoulders are intricately connected by several different muscles. The most superficial muscles being the upper trap, middle trap, and levator scapula. The brain communicates with these muscles through the 11th cranial nerve and the nerves at C3 and C4. These muscles contract the shoulder towards the neck, which causes pressure on the upper part of the vertebrae, creating tension and pain. The muscles that are much deeper are the transversospinalis and splenius capitis. The nerves that innervate these muscles are found from the C1 through the C6. These muscles connect the head and neck, which means looking down, like reading, computer work, or especially phone or tablet work, can cause problems. Start in a side-lying position with a foam roller between the neck and shoulder. Use your top leg to press into the floor, rolling your body up, which will create pressure downward through that shoulder. You're trying to create as much movement between the ear and shoulder as possible while relaxing the head toward the floor. You may increase the intensity of work by rolling the foam roller up and down using your hand. To work different points of the neck, simply roll backwards, keeping the chin and chest directly in line while opening the shoulders to the ceiling. An additional way to create greater intensity is by creating a saw-like motion, pulling the end of the foam roller toward your neck and then relaxing. You need to allow yourself to relax during the saw-like motion to break down the muscle tissue in the upper trap and neck. Continue to change the position, working the areas that are most tender. If you are tensing your body, it is not helping. My recommendation is to continue this work anywhere from 2 to 3 minutes on each side before moving on. A common headache that comes through my door is when someone comes in and paints across the forehead the pain that they feel. Commonly, it's also associated to have eye pain with this sort of headache. The muscles typically causing this headache are actually on the back side of the head, and they are called the occipital muscles. When the occipitals get extremely tight, they pull on the back of the head over the top of the head, creating the tension and pressure you feel in the forehead. So let's take a look at how to release these muscles to get rid of your headache. Using 2 lacrosse balls directly on the back of the head and lying on the ground, use a book to elevate the lacrosse balls. You're going to press down into the lacrosse balls and move them around the back of your head until you find the part that is most tender. At this point, you're going to begin pressing your head down into the lacrosse ball as hard as you can tolerate. This pressure should recreate the headache that you commonly feel across your forehead. Continue this pressure for 30 seconds. I will continue to talk you through the 30 seconds here. Do not let up on your pressure. Continue to push as hard as you possibly can in the occipital muscles in the back of your head. Try even increasing the tension and feel the headache. You know you're doing it correctly if you continue to feel the headache the whole time you're on these muscles. And we finish in 3, 2, 1. Wonderful. Now we're done with the occipital release. Next, we're going to be working on the atlantoaxial junction and the rest of the cervicals. The first muscles for us to focus on are at the atlantoaxial junction, and they are called the obliquus capitis major, obliquus capitis superior and inferior, and the rectus capitis posterior minor. Once we have worked through those, we will work on the rotatories and the semispinalis cervicis. Laying on your back with a book under your head and neck, place the lacrosse balls directly in line with the junction of the head and neck. Once you have the lacrosse balls in that position, tilt the head up and down like you're nodding your head yes. This should cause a contraction of the muscle tissue on top of the lacrosse ball and then a stretch as you look down. Once you've completed the work on that junction, move down 1/2 inch to the next cervical and continue this process until you have worked your way down the entire neck. Be sure to get a tight contraction tucking the chin, followed by a strong contraction tilting the head back in order for this technique to work. If you get to a point where it feels like one side is worse than the other, you may rotate your head to that side and continue to nod yes. For example, if I had some extra tension on the left side of my neck, I would rotate my head to the left and continue to contract up and down. Remember to do this continuously through the entire neck, rotating to the left or right as needed. Our final release is going to be on the upper and middle trap and levator scapula. These muscles contract the shoulder to the head. This release requires a massage stick and a clear wall. We want to start by locating the trap and levator, which holds the shoulder up to the ear. Once located, lean against the wall, allowing the stick to press down into the shoulder. Once you've created that pressure, you can start turning your head down and away from that trap. You'll notice I continue to hold the massage stick with my right hand and let the massage stick push my left shoulder down. Continue to create this pressure until your shoulder feels relaxed.